How's it going, man?
Good to see you, Dr. Anant.
Good to see you. Good
Yeah,
to see
man.
you.
So we're here at Clinical Application of Longevity Medicine 2026, and
Yeah.
great event, and learning a lot of great stuff. What are you hoping to get out of this meeting?
This meeting is so timely because
Yeah.
there's so many things going on in our field, and it feels like everything's moving so fast now. From a regulatory standpoint, we heard a lot about that this morning about new regulations affecting practice. But then also on the technology side, which I know
Yeah.
we're going to talk about later, there's just so much happening in
Yeah.
the enabling technology space, specifically AI, that's changing how a lot of us are thinking about practice. And
Yeah.
I'm curious to hear from you. Like you see patients, you run a practice, you know, how are you thinking about AI? Like, are you using AI? I know
Yeah.
that you use it quite a bit in your own practice, but
Yeah.
like, how are you thinking about it strategically?
Sure.
And as far as, your business and where you want to go?
Yeah. So we use almost every one of my team members and I use AI in almost everything we do. So AI has really changed the landscape. It changed the way we can be more efficient and really take away a lot of the friction that gets in the way of us getting our job done. When it comes to our clients, I think one of the scary points right now, which we can leverage, is the fact that they're now using AI without any guardrails. They're putting in their information, asking questions, and now they're getting sometimes hallucinations, wrong information, or
Yeah.
most importantly, they don't understand the context and the nuance of the information they get and how to
Right.
apply it. I think that's where we come in, as longevity medicine experts to really help our clients understand the nuance and provide the human element to it, the interpretation, application of the information that I think is so important, because otherwise it's just noise. It's just information, which is noise. And so that's how I see AI. What about you?
Yeah. I mean, it reminds me a lot of when the internet first became a thing. And now, granted,
Yeah.
I wasn't practicing back
Yeah.
then, but I do remember hearing from, family friends of mine who were in practice, seeing a lot of the same things that physicians now are saying about AI,
Yeah.
where patients now have access to so much information. And I think AI has amplified that even more.
Yeah.
And I think it really places a responsibility upon us to number one, like, keep ourselves informed, or like coming to conferences like this so that we're really tuned in to
Yeah.
where the field is.
Sure.
But then also like being equipped to engage with patients about what they're coming to us with, which I
Yeah.
think requires us to engage with these tools ourselves to understand why people may be coming in with the understandings or the perspectives that they do. Like, I think one really good example of this is that I don't know about you, but I've found that these frontier large language models, whether it's Claude or ChatGPT or Gemini, are really excellent at kind of conventional evidence-based medicine. Like, they're really, really good at kind of giving us what the latest guidance might be from a specialty society and how that might apply to a clinical situation. But a lot of times the medicine that we practice is much more personalized. It's much more kind of first principles driven. It draws on a broad experience base that isn't necessarily on the internet. And so I find that these large language models are not very helpful at all in many
Yeah.
cases for the sort of medicine that I practice. And so I think that's, one thing that's been helpful for me to understand what are the limitations of these models, what are they trained on, and then how do I kind of step in and fill in the gap when the patients have questions for me.
Yeah, totally agree. So we've actually invested a lot of time, effort, and money into building in our app for our clients, specifically just that, where it's a custom agent that allows you to take your own personal data. And that makes all the difference in the world, because now it's being fed not just by the World Wide Web, by mass information out there with no relevance or context, but their own actual biomarkers and genetics and their own history and clinical notes, et cetera. And so I think it's great for clients to be able to have that contextualized response, not just the generic response that could often be misguiding, misleading. And then on the practitioner side, on the doctor side, I think it's also incredibly valuable, where now what it enables us to do is really just speed up the process. It's not that we're ever abdicating clinical judgment. That's something that I don't think will ever go away. But I think that AI can help docs assimilate the information, recognize patterns quicker, and understand really all of the data that may be disparate, and how can we bring it together to make our job easier, so that when we're with our client, we can spend more time on really understanding the nuance. And you know how at every client we see, there's so much little human element to it that gets lost. And I think that AI can never replace us in that sense. They could help us bring all the data together, but then it's our job to really provide that individualized, personalized care that's so important.
That's very well said. And I think what you just said kind of makes me reflect on what are the ways in which AI has, I think, meaningfully enhanced how I practice and how some of the groups that I work with practice. I think certainly one of the obvious ones is related to workflow, right? I think that's where these ambient scribes, transcription, data summary, I think a lot of that has been tremendous. I think number two is, I think, somewhat related to what you just said, which is this kind of integration and assimilation where AI can look at many different data points all at once and kind of help us make sure we're not missing anything, if you will. I'm sure you in training and me and even in practice, we all have at times like overlooked a lab value here or there just because we're dealing with so much data. And I think AI can help us be less prone to that. So I think there's that value. But I think the third thing, which has been interesting to me, and this is not something that I've experienced until I've kind of had to build kind of my own tooling. Earlier I said that AI is not very good at doing this type of precision, personalized longevity medicine. But if it's coached and trained the right way, and if it's given access to the right set of knowledge that's structured the right way, which is what I've spent a lot of time building for myself, it can actually be really helpful, actually giving you ideas and generating hypotheses for you. And that's where I'm super excited about the future of all this, because in the last couple months, I've just seen a real quantum leap in what these models can do when given the kind of materials and kind of foundation that I've built for them. And just giving me these amazing perspectives on cases that I've been dealing with that I wouldn't have thought of myself. This is when people talk about AI can actually help advance medicine itself, I start to think about things like this, and my hope is that this sort of thing becomes more and more common.
Yeah, I'm totally with you. There are a lot of doctors who are like threatened by AI, and they're concerned that AI is going to take their job, and I think that's almost never going to happen. There are exceptions, of course. There are certain specialties that may be a little more sensitive to that than others. But I think the key is that AI is really to be leveraged and to be used as a tool for us, and something that we can use as a support, like for example, like you said, to be able to assimilate the data, and then we still need to apply our clinical judgment to it. That human element's never going to go away, but it's going to allow us to get there a lot quicker and be able to really put together all of the recent data points that a client may have, and then understand how do we interpret it. But then it's our job to assimilate it and ultimately come to the client with that, and I don't think that's ever going to go away.
I totally agree. I think if anything, it'll make the practice of medicine even more interesting and even more fun. That's what I found. I think, and this, if you just look back at history, right? When these major technological breakthroughs have happened, yes, certain, jobs or professions have changed, but people have just moved up in terms of their level of thinking and how they engage. And I think the same will happen in medicine. Like, I think there are some things that we do right now, like documentation and billing and even some basic kind of lab analysis that I think will probably go away to AI, but that will then open us up to be operating at an even higher level of abstraction. We're starting to think about problems in entirely new ways, and so I think it requires us who are in the field right now during this moment of change to always be learning, right? Like to always be pushing ourselves. That's why I love coming to conferences like this and talking to people like you, is because we push each other, and I think that's so important in this day and age.
I love it. Yeah, I think that AI is an incredibly powerful tool that's on our side if we use it and leverage it the right way, and recognize that there are ways that we can really improve our efficiency and improve our ability to provide better patient care in the long run. Well, enjoy the event here. Some amazing talks. We already heard some great talks this morning on cardiovascular risk assessment from Dr. Hussain that were incredible. And
I mean, it's amazing how even something as well studied and established as cardiovascular disease, right? We're finding new ways to think about it. And I think Dr. Hussain's talk was a really fantastic example of that. And I think that that's why I love this meeting in particular, is because we're taking new lenses at both new and old problems, right? And I think always trying to think about how can we think about a problem differently. I think is so important.
Absolutely.
So,
great
fun.
stuff. Yeah, well, great to get to connect with you here at the event. What are you doing right now with I see you're training, and Dr. Rob, he's one of my docs working for my team now.
Oh, nice.
He's raving about your stuff, so I'm like,
Yeah.
I don't even know what your stuff is, but he's like raving about it, so you must be doing some good work.
I kind of encountered this problem when I was practicing, right? Where I just felt like, hey, AI is amazing, but it's not very good at the type of medicine that I want to practice and that a lot of other people that I know want to practice. And I think fundamentally what it comes down to is there is a gap between like conventional evidence-based medicine, which is statistically based, population-based medicine,
Right.
and what I'll call like basic science, which is kind of at the frontier in longevity medicine, and that's kind of more the domain of like the lab and research and that sort of thing. I think in longevity and precision medicine, what do we want to call what we're doing, right? Like, let's just use the term longevity medicine. We kind of operate in between, right? Like we are obviously aware of and we always consider evidence-based medicine, but then at the same time we also want to try and go beyond that when it's appropriate to help people solve their problems.
It's a blend.
I would say the majority of our patients, who come to people like us, will have tried the conventional evidence-based approach, found that it's not working for them, and so we have to open up the playbook a little bit more. And so I found that AI was not really helping me do that. It wasn't helping me get this broader playbook, wasn't helping me think in the way that I like to think. And so what I did, and honestly, I just did this iteratively over the last 3 years, was build up kind of an AI-based pipeline as well as kind of a curated knowledge base that replicates kind of how a good, I would say, longevity clinician thinks about problems like this. Mm-hmm. And I now use this for myself, and then after using it for myself for a period of months, I decided like, hey, this seems really useful to me. I wonder if it'll be useful to others. And so I launched this in the fall and made it open to other clinicians, and the response has been super positive. I'm always looking for ways to make this available to other people. Yeah. If people are building their own AI platforms, I want to find a way, if it's possible, to make, is there a way that we can work together or that my platform can make another platform better? Yeah. I'm all about finding a way to just grow and lift up this space because we're all, there's plenty of people who need our help.
Yeah, so. Amazing. Yeah. So I built Gapin Institute when I left urology. I built Gapin Institute as my, longevity center, if you will. It was really men's health initially, then it really shifted to precision performance medicine. That's really the hill that I'll die on is precision performance medicine, which is really, optimization. It's longevity medicine focused on optimizing my, the way I show up and live and perform today. We became very successful very quickly, and I realized that I figured out the secret sauce of how do you build a practice, a high-level premium program, and other doctors were asking me, well, how did you do that? Can you help me? And so I realized that I'm an entrepreneur at heart. As much as I was a doctor for 25, 30 years, as a surgeon, running a urology practice, I love the business side. I love building a team. I love building a program and putting all the pieces together. And so I shifted from Gapin Institute to Peak Launch. I rebranded and really licensed my program. So now my Peak Launch signature program, any doctor can run, and we have the coaching, the functional coaching, and all the diagnostics, and the genetics, and the wearable technology, and a beautiful, sexy app, Peak Launch OS, that puts it all together. And part of the app is where you can message your team whenever you need anything. All refills are on there, scheduling is on there, all your results are on there, and the key part that we've recently added is PLX. And so PLX is the AI agent, custom agent, that has a binary input. So one input is our own library of, the resources from Dr. Hussein's talk this morning, for example. That's going in my library. That's legit good science that my model can train on and know that this is really the gold standard for how you assess cardiovascular risk, et cetera. On the other side, I have de-identified client information. So lab results, genetics, wearable tech data, all of their functional tests, microbiome, cortisol, their health assessment, their clinical notes that all come in the other side, and now it feeds that into one agent that now you can ask it anything and it's going to give you guidance based on your own information. And so there's the client side right now, and then there will be the doctor side we're in evolution of. For the provider, same thing, to take that information and really assimilate it and get there quicker. I think there may be some work where we can do together, where the work that you've done can definitely go on especially on the provider side. But we could definitely, I think it's something we could build together there and make it,
No,
I'm all for,
absolutely.
I'm all for working as a team.
I love it. I've spoken to a couple of docs about, because, actually some of these folks are actually in other countries, but you've built a platform that's enriched by your own curation, right? Like your own protocols, and then your own curation of other knowledge that's out there, which is so important, by the way. I think one of the reasons why I actually don't think, absent like efforts by people like you and me, I don't think frontier AI is going to get any better at longevity medicine, because if you think about it, it's trained on everything. It's trained on the corpus of the internet and of every published study available.
It needs to be filtered.
It needs to be filtered.
That's right.
Like that's why I believe when you ask it questions that relate to our field, you get sometimes very watered down answers. I think there has to be curation. There has to be a structured kind of thought process. There has to be, and like frankly, a lot of the knowledge that is here is not on the internet.
We really built the entire client experience. For me, it's all about a perfect experience and making the app as functional. What do people want? It's like, I don't want to run out of my stuff. So like when I'm on like 8 supplements and 3 peptides and 2 hormones, and what's going to happen? In 30 days, you're going to run out, right? Our goal is you never run out of anything.
Right.
So the fulfillment part of it, the refilling side, the scheduling of the appointments, the notes, and then the other question I get is, well, I just want to be able to ask my doctor a question. On the app, you could directly text your doctor and ask him a question, and it comes directly to that doctor. So
I think that operating system piece is so important, especially if it. I mean, in theory, all of these things exist as point solutions, but when you do that, when you purchase like 5 or 6 or 7 different point solutions, it all feels extremely discombobulated, scattered, and it just makes you chafe at practicing.
Absolutely.
That's what happens to a lot of doctors. And so, if you can put everything into something that's cohesive, coherent, integrated, and automated increasingly with AI, I think you have something really, really, really cool.
Yeah, amazing. Before the license, before a doctor would ever be a candidate for a license, they go through, there's a mentorship program that I built, and I think there might be some synergy there as well, where I'm teaching doctors how to build their business, but on your side, I know you're working on training how to use AI to the best of your capacity. So a lot of alignment there. We should talk further.
We should.
Awesome.
Cool, man.
Cool.
All right.
Excellent.
I think we're done.
That was good stuff. Cool. Yeah.